Again, Dr. Cameron Gholampour, chiropractor out of Tampa, Pete, Florida. So I am out of a sports performance facility tailored mostly towards baseball. Over there, obviously, work with mostly MLB, minor leagues, as well as volleyball. And then my other office is out of a powerlifting gym, so mostly CrossFit, powerlifting, and fitness-oriented individuals. So I have a little bit of everything: Shockwave, PEMF, all the toys. There's Winback I got introduced to at a huge chiropractic conference, FCA the National, last year by Dana actually, and it was something immediately that I wish I got before I got all the other fancy toys, because it would have 100% saved me a lot more money and would have done the job just as efficiently as a lot of those other products. So I've had it in my office for months now, between my associate and I, and I have the back one unit. It's been great between two offices portability wise, and it immediately made an impact on. We see more shoulders and knees than anything. Cash-based practice, and we practice at hour intervals, and the bracelet especially has been a game changer. Patients absolutely love it. They think it's extremely cool, but I did treat a lot more different things as well, especially after ACLs, meniscus surgeries, and do some scar tissue work, things like that. But it's getting to the point now where patients are loving it so much. The days when the win back isn't there, they're purposely scheduling only when it's there, just because of the how great it feels and all the rehab that we can do with it. So in our office, with how we manage things, it's been a game changer on that end. And if you treat mostly athletes, it's definitely something you need to consider in having in your practice.
So a question I was going to ask you, Cam, there, and you were talking, kind of touching on that, but just kind of the various between using a CET head or an RET head or the bracelets, kind of where that fits into kind of both treatment program or protocol for the patient or your patients. I know you just mentioned on scar tissue. Any other accessories? I know some will use a blade instrument and with the bracelets on and such as that for doing some more soft tissue. Kind of the length of what you see your treatment mode being also with many of your patients. It's less than 5 minutes, or if it's 10 or 12 minutes, kind of what that looks like.
Of course. So, I mean, the CET more for the musculotendinous and the RET more for the hard tissue ligamentous stuff. So again, shoulders and knees, depending on what it is. Rotator cuff strains are the number one thing we see. So definitely using the CET on that. And then I would transfer to the bracelet and do some manual therapy, some ART, or whatever three-letter words you want to be able to use. And if you do any dry needling, that's also great. Be able to put your hands on it and get some of that energy transferred through those needles as well, and do it safely. And then something like a meniscus issue, right? Then that's mostly the RET using that, and then again incorporating the pad to get active with it, be dynamic. So they don't just have to sit there and you have to move around. We'll throw the pads on or put them on a plate, make them do some dynamic movements, some closed chain or some open chain, depending on what they need. And that's mostly the RET setting as well. So CET, again, mostly the musculotendinous stuff, the hamstring strains, rotator cuff strains, tendinopathies, and the RET is mostly the ligamentous issues and deep achy joint stuff.
And length of treatment, do you think you're spending 5 to 10 minutes with Winback or less?
For the musculotendinous, 5 minutes. For the bony tissue and ligamentous stuff, definitely a little longer, about 10 minutes. The times where most of it I'm incorporating a little bit of both could range anywhere from 10 to 15. I think the longest I've ever done it was 20 minutes, just because they were in extreme amounts of pain and there was nothing else we were going to be able to do. So just get them feeling as comfortable as possible.
So just kind of early on, just kind of wrapping this up, but what would, if you said, what was a couple patient comments, obviously just saying, hey, if it's not there, I don't want to be there. You already reiterated that. Patient comments about treatments, both kind of initially and then maybe further on into a protocol, a few treatments later, responses from the patients or comments if they were going to go out and sell the outcomes to some other patient.
Of course. I mean, the first response is, this is the best thing the most comfortable thing that you've gotten. It's extremely gentle. The warmth is incredible. I mean, obviously too much of anything could be a bad thing, but it feels incredible. They see immediate results, and with their rehab, it makes it more tolerable as well. Some of my international pro basketball players in Europe, the first thing they did when they got back overseas was send me pictures with their teams that had it. I had a player with Victor Wembanyama over there. He was on that same team. So the first thing was make sure they had a Winback. And it's been, again, they've all seen the benefits. They've loved how it feels, especially, and it just makes the rehab so much more comfortable with them.
So just closing thought, if you're gonna, I know we've got a couple individuals on the call tonight, kind of giving some consideration to putting a Winback device in their office. Just a closing comment on, what that could look like for them.
Yeah, I mean, like I said, I have all the bells and whistles in my office. I work with pro athletes and fitness-oriented populations. Depending on whether it's a kid or older person, pro athlete, I've had nothing but positive feedback. It's something, like I said, between laser, shockwave, PEMF. I wish it was one of the first things I got because it would have just checked a lot of things off my list and I would have been able to treat a lot more things earlier on in my career.